by Stout and Felice J. Freyer Globe Correspondent and Globe staff. July 31, 2018. The Massachusetts Legislature barreled into the final hours of its legislative session Tuesday with reams of major legislation still pending, including bills addressing healthcare, opioid addiction and education funding. Ahead of a midnight deadline to wrap its formal votes for the two-year session, the House and Senate were dispensing of several smaller bills at the State House while legislative leaders huddled behind closed doors on some of the more complicated pieces. On their plate were at least 5 major items, including a $600 million-plus economic development bond bill, in which lawmakers were also trying to craft language aimed at limiting non-compete agreements. Lawmakers were also trying to reconcile 2 disparate bills: healthcare bills aimed at helping smaller hospitals and controlling costs. Get fast forward in your inbox. Forget yesterday's news. Get what you need today in this early morning email. Thank you for signing up. Sign up for more newsletters here. A House proposal would apply $330 million in new assessments on insurers and large hospitals to funnel money toward community hospitals. It also included new assessments on urgent care centers, retail clinics, and surgery centers, requiring such clinics to pay 0.75% on the total amount they charge commercial insurers. The provision has drawn criticism from leaders in the growing industry, who called the assessment devastating. The Senate, meanwhile, opted to set a rate floor for insurance payments to help the hospitals. It would mandate that they be paid at least 90% of the average price of a medical service. It also would require some large hospitals to pay hefty penalties if spending rises too quickly. A sweeping bill aimed at the state's opioid epidemic also remained in the air. The thorniest parts of the multifaceted legislation involve a so-called 72-hour hold, and the question of providing medications to addicted prisoners. Governor Charlie Baker wanted to give medical professionals the authority to hold addicted people against their will for up to 72 hours in a treatment facility, if the person was in danger of harming themselves and others. Such a provision, proponents argued, could prevent people who survived an overdose from going out and overdosing again, and might give them a chance to consider engaging in treatment. But human rights defenders objected to holding people against their will, and doctors called the proposal impractical in the current system, because too often there are no treatment beds open and patients will end up waiting in already crowded emergency rooms. The House rejected the 72-hour hold altogether. The Senate proposed a scaled-back version to allow temporary involuntary commitment of addicted people only when courts are closed for business. The bill would require a judge to make the decision that the person can be committed. Baker's bill made no mention of prisons and jails, but a coalition of 26 major healthcare organizations lobbied the legislature to follow the example of neighboring states and start providing treatment to opioid-addicted inmates. Currently, when people addicted to opioids are incarcerated in Massachusetts, they are forced into withdrawal and then denied access to the main medications used to treat opioid addiction: methadone and buprenorphine, often known by a trade name, Suboxone. This puts them at high risk of fatal overdose upon release. The House voted for a pilot program at 5 prisons and a treatment program for civilly committed men that is run by the Department of Correction. In those 6 facilities, people who were taking methadone or buprenorphine when incarcerated would be allowed to continue their medications behind bars. In 2 of them, inmates could start the medications during their sentence. The Senate focused instead on the county-run jails and houses of correction, requiring all of them to provide anti-addiction medications to inmates who already were taking them before incarceration and to inmates at least 30 days before release. It would also require the medications at 3 prisons. The House and Senate were also trying to reach a pact on how to revamp the state's school funding formula. The negotiations, which started in a closed-door conference committee last week, have come after a report released earlier this month said that Beacon Hill lawmakers have been shortchanging the education of the state's students by nearly $1 billion a year. An animal welfare bill also remained locked in a conference committee tasked with hashing out different language passed by each chamber. The packed agenda, combined with the biennial mad-to August, was expected to end with a flurry, and potentially, with little public debate or review of some of the major bills. The chambers spent time Tuesday moving a compromise bill on energy closer to Baker's desk, while also waiting to see if the Republican acts on a bill the legislature passed Monday to begin taxing short-term rentals. Baker has 10 days to act any of the bills once they reach his desk. Layered onto the late-session frenzy were rapid-fire budget overrides in recent days and votes on amendments Baker added to the state's recently signed $41.7 billion budget. Priyanka Dayal McCluskey, Tim Logan, John Chesto, and James Vasnes of Globe staff contributed to this report. Reach Matt Stout at matt.stout@globe.com.